Hello friends, I am Prabhjot, your Occupational Therapist, and today we are going to talk about rhythmic movement training. This topic has been requested a number of times in the comments section, and I want to discuss first how are these rhythmic movements going to help your child. Whether your child is autistic, you think they are hyperactive, have speech delay, have academic challenges, do not focus on activities, have minimum attention, and most importantly, how are these movements going to help in reflex integration? The first use of rhythmic movements, improvement of motor skills and coordination. How exactly? Because these movements help in stabilizing the movement patterns of the child. So whether you talk about stability in terms of gross motor skills, fine motor skills, even postural control of the child, how stable and balanced they are. These movements are gentle pre-birth movements which give the child a sense of safety and security while doing them. Also, it increases the awareness of both sides of the body because this rhythm is following on either side of the body and bringing the child more towards midline orientation. Also, because these are rhythmic movements, they also help in increasing neuroplasticity in the child's brain, which helps in learning. The second use of rhythmic movements is improvement in social interaction. How exactly? Many of these active movements the child may be imitating with the parent or the therapist, creating a connection between them. The movements are symmetrical on both sides, more rhythmic, so there is a rhythmic timing to them. Identifying different social cues, so when the parent is instructing the child, keep your body relaxed, let's try to do the movement slowly, you will see that the child also starts to actively participate even in the passive movements. The third use of these rhythmic movements is for emotional regulation and sensory processing. How? It helps the child because they are rhythmic movements. The child feels a self-soothing, calming effect, helps in reducing their anxiety. So these could be practiced before starting an activity. There is a rhythmic pattern, so it creates a connection between both sides of the body as well as both parts of the brain, the right and the left brain. So helps in controlling of emotions in the child and reduces their sensory overload. And the fourth use of rhythmic movements is for communication. How? We already talked about how both sides of the body and the brain coordinate. So one side is perceiving the environment and the other side is learning a positive way to respond to it. If you add some kind of rhythm, some kind of music to it that the child enjoys as part of music therapy, the child will enjoy these rhythmic movements even more and actively participate in them and help in positive expression of emotions. The key point to rhythmic movements. Even if you are doing these movements with your child, are you following the correct frequency and duration of rhythmic movements? Well, in the initial stages, don't go beyond 2 to 3 minutes of rhythmic movements to avoid any kind of sensory overload because it is still movement on the body of the child. They might not be comfortable doing it for too long. Later on, you can expand the time and take it maximum to 15 minutes, and that too can be done in breaks. So 5 minutes, some gap, 5 minutes, then gap, and the final 5 minutes. I hope this video gave you a good understanding of how rhythmic movements are beneficial for children. If yes, do like the video and subscribe to the channel for more videos related to child development. Add any queries or suggestions in the comments below, and don't forget we will be covering rhythmic movements for different reflexes as well as general how to perform rhythmic movements at home. And also share the video so that maximum parents benefit from it. We'll meet again soon.